I'm Christine Eckermann-Ross. I've been working here at Avian and Exotic Animal Care for 11 years. My interest in exotics stems from pets that I had as a child. When my father was a veterinarian, I grew up around animals, so I always sort of knew that I wanted to be a vet. I think one of my motivations for going into exotics was my experience with my own pet bird when I was a child. We took her to the vet on an emergency visit, and they truly had no idea what to do. But I think as I was developing my career interests, I knew that we could do better. We're going to use acupuncture to help stimulate appetite and keep things moving the way they should do. In terms of the alternative medicine, the more you get involved in exotics, the more you realize there are very few medications that are actually approved for use in these species. So especially for the small herbivores, I figured herbal medicine was probably a good option. For whatever reason, Chinese medicine, the philosophy of it really resonates with me, and I feel like I can use it very effectively. And to really understand Chinese medicine and be able to use the herbs effectively, the foundation comes from acupuncture. And so I went to acupuncture classes first and really studied acupuncture and learned the philosophy, and then pursued this study in Chinese herbal medicine as well. I think we're probably most familiar with acupuncture as being a means of pain control. And we know that when we insert acupuncture needles, we get the release of endogenous endorphins, and morphine-like substances in the body's natural painkillers can increase as much as 500-fold.
This is Scruffy. He's 6.5 years old. He had an ear infection, and he didn't quite regain all of his balance. And on the other side, he's got a mass, and we think that's still affecting his balance. I don't think surgery is an option at his age, and there's other complications that can go along with it. So we're going to go with an alternate therapy of acupuncture and keep him on the medicine, kind of hopefully control the growth of the tumor.
Ferrets unfortunately have a lot of health issues, a lot of different types of tumors, a lot of gastrointestinal problems. They're one of the few patients we know for sure can get the flu from us, and not only can they get it from us, they can give it back. Ferrets are strict carnivores, so a lot of people will want to feed cat food or they'll want to feed treats off of their plate. Not only are they strict carnivores, they really can't tolerate a lot of carbohydrate, so they're just not going to do well unless you have them on a very high quality protein source. Hi, sweetie. Okay. I am going to need you to scrub him. He has never been a, what we would call a relaxed ferret. So I always feel for active acupuncture points. There are certain things we can feel for sure, like muscle tension or muscle knots, what we might call trigger points. Whether they feel depressed or cold or hot, we can tell certain points are just kind of asking to be stimulated. Traditionally, acupuncture, you're taking a very thin, flexible needle, you're inserting it into an acupuncture point, leaving it for a certain amount of time. Aquapuncture is for animals like ferrets or mice that are wiggly and aren't going to sit still, or birds that are going to pull that needle out just as soon as you've placed it. You can inject fluid, so it could be saline, it could be a vaccination, vitamins, just using some safe solution and injecting that into an acupuncture point so that you get some stimulation there, and it can be done quickly without having to leave a needle in place. He's actually tolerating this really well. Yeah. It's nice when you can leave needles in because they often do relax, but ferrets just don't seem to let us get that far. Oh, I know, you're all right. It's okay. Shh, 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 shh. Okay, bud. Okay, I know. It's still. It's okay. Oh, see, so much better. So much better.
Works for me.
We're using vitamin B12 to do his treatment.
So I worry about this stressing him out.
If we come back in a week and try again, I think we're going to see a much more relaxed ferret. We're going to see this go a lot more easily. Okay, you know what? If you don't want us to do that point, we don't have to. It's okay, you're done. You're done. It's all right. It's all right. Anybody who wants a ferret as a pet, and they're irresistible, who wouldn't want them? I think it must be hard to have a bad day if you have a ferret in your life. They always will make you smile. But I think it's really important to research. They need to know what the common medical problems are, because it can be a real undertaking. You need to have a real commitment and know that you might face some of these problems, and unfortunately will likely face some of these problems.
You know, if nobody else gets any message, do your ferret education, go online, because if not, someone like me will be adopting your ferret because we don't want it euthanized.